Community Health Worker Training, Cardiovascular Health and Diabetes, Module 2C, Heart Attack Diagnosis, Treatment, and Rehabilitation. Learning outcomes for this mini-module: explore procedures for diagnosing and treating heart attacks, identify community health worker activities to create care connections for people with a history of heart attack or at high risk for one. Let's start with Chad's heart attack story. Click on the link and that will open the short video for you. And then when you're done, close out the video window and come back to the PowerPoint. As you're watching this video, pay attention to what symptoms was Chad having that made him think that something was wrong. How did he have his wife respond? What kind of treatment did he get? And then what kind of recovery did he have? Diagnosis and treatment. If someone is having symptoms of a heart attack, you should call 911 immediately. Don't try to drive them to the hospital, and certainly if you are having symptoms of a heart attack and you're alone, call 911. Don't try to drive yourself to the hospital. It's important to call 911 right away. For one thing, people who get treatment for a heart attack quickly are more likely to survive. In addition, EMS or emergency medical services, ambulances, can start life-saving medicines and other treatments even before you get to the hospital. Many people's heart may stop beating during a heart attack. This condition is called sudden cardiac arrest, and EMTs have the training and equipment to start CPR and to start treating you if this happens. They can get you to the hospital faster than somebody driving a car, and when an ambulance pulls in, you're more likely to receive treatment quickly once you get to the hospital than if somebody pulls up with you in their car. And in general, EMTs and ambulance personnel have the training and equipment to act quickly. If for some reason you can't call 911 or the ambulance can't reach you, have someone else drive you to meet the ambulance or drive you to the hospital at once. Never drive yourself. Obviously, if your heart stops beating when you're behind the wheel of a car, you could crash and not only hurt or kill yourself, but also injure other people. Why is immediate medical attention necessary? Every minute counts. The chances of survival, of staying alive after a heart attack, are greater if you get medical treatment immediately. Minutes matter. The chances of surviving a heart attack and limiting damage to the heart are best if a person receives treatment within the first hour after a heart attack. The longer that the treatment is delayed, the worse the damage to the heart. Every minute that treatment is delayed is a minute the heart is without enough oxygen. People who have a heart attack need emergency care, such as cardiopulmonary resuscitation, CPR, or electrical shock, defibrillation. That's why you need to act quickly once you notice the warning signs of a heart attack. If someone who appears to be having a heart attack is not awake, does not know what's going on, or stops breathing, someone may need to begin CPR right away. CPR involves mouth-to-mouth respirations, breathing into another person's mouth, and chest compression, pressing on another person's chest at a steady pace. That provides oxygenated blood to the brain and heart and keeps them alive. The American Heart Association says that as CPR is given to a person who is not breathing, it can double the heart attack victim's chance of survival. Sometimes the heart attack victim also needs external defibrillation. An AED, automated external defibrillator, is a medical device designed to shock the heart of a person who's in cardiac arrest, who has no pulse and is not breathing, and to shock it back into a normal rhythm. Timing is very important. For every minute without immediate CPR and defibrillation, the odds of survival decrease by 7 to 10%. You can find AEDs, automated external defibrillators, in public and sometimes private places where large numbers of people gather, such as airports, sports stadiums, schools, or places where people who are at high risk for heart attacks live, such as nursing homes. Community health workers should become certified in CPR and in the use of AEDs. This is a complete training in and of itself. How is a heart attack diagnosed? When a person arrives at the hospital with heart attack warning signs, the emergency room staff goes into action. Diagnosing a heart attack usually includes 4 steps. Review of a person's medical history information, including risk factors, and including a description of the symptoms that the person is having now. A physical exam, an electrocardiogram, an ECG to test for heart damage. And this looks like a series of stickers and wires that are put on the person's chest to monitor the electrical functioning of the heart. And blood tests to detect abnormal levels of enzymes that show that the heart has been damaged. How is a heart attack treated? If the person is out, the first thing that will happen is resuscitation, so trying to get their heart going again and getting it to a normal rhythm. Then if they get to the emergency room fast enough, or sometimes this even happens in the ambulance, the next treatment will be medicine to dissolve clots, and that medicine may help to dissolve the clot that's blocking the coronary artery so blood flow can return to the part of the heart that was starved of that blood flow. To work best, these medicines need to be given within 3 hours of a heart attack. If this treatment isn't given or doesn't work, or only works partially, other procedures may be needed, such as surgery. One type of surgery doctors may do is coronary artery bypass. This is cutting a vein or an artery from another part of the body and sewing it into the coronary artery that's blocked. So they sew it before and after the area that's blocked so the blood can literally bypass that area that's blocked by a clot. So if you can picture almost like a bridge on a highway going over the area that is blocked. Another type of treatment is coronary angioplasty. And in this case, doctors pass a thin tube through the artery until it reaches the blocked artery in the heart. A small balloon is attached to the end of the tube, and it's then inflated to open the blocked artery. Sometimes a small wire mesh tube is put in place to hold the artery open, and that tube is called a stent. So once the balloon is blown up in there, it sort of pushes the clot and the plaque that's blocking the artery. It pushes it back and opens it up, and then the balloon is deflated and taken out so the blood can flow freely there. Life after a heart attack. Some people recover completely after a heart attack, but in some cases the heart may still be damaged, and that could affect the heart's rhythm, pumping action, and blood circulation. People who've had a heart attack are also at risk for another heart attack or conditions such as stroke, kidney problems, and arterial disease. But there are steps they can do to help lower their chances of having future health problems, and community health workers can help. So there's certain feelings that many people have after having a heart attack. Lots of times they're afraid, right? They may never have thought about their own mortality before, and now they realize that they could die. They may feel overwhelmed at the changes that they have to make. They may feel helpless. They may be angry. They may be feeling despair over the loss of good health. And depression after a heart attack is also pretty common. And some people actually feel thankful afterwards that they survived it, and sometimes they will make a resolution or resolutions to try to do what they need to do to lower their risk of having a future heart attack. The person's doctor may recommend cardiac rehab, which is a program that can help them make lifestyle changes to improve the heart health and quality of life after a heart attack. These changes may include taking medicines, changing the diet, increasing physical activity, stopping smoking, and managing stress. And cardiac rehab helps people to make those changes. It also makes sure that they're making those changes in a safe way. So for instance, if somebody's had a heart attack and they want to start exercising, they need to be monitored carefully to make sure that they're not overdoing it. And cardiac rehab is one way that that can happen. Other things that someone who's had a heart attack may need to ask their doctor about is when it is safe to go back to everyday activities, including work, travel, exercise, and sex. Now listen to Helen's story of her own heart attack and her rehabilitation from it. As you watch the video, think about how to care for and provide information for heart attack patients and their larger social support system. What could you do as a community health worker to help people rehabilitate after heart attack and avoid future heart attacks? The role of community health workers. What can community health workers do to help? Really important to educate people on the risk factors of heart attack, to educate people on a heart-healthy diet, and these are people who have had heart attacks as well as people who may be at risk of one. Use motivational interviewing to help people make better lifestyle choices. Help people understand the warning signs of heart attack, and urge people to act quickly on signs of heart attack, calling 911 for immediate help. You can also support people who've had a heart attack and are in cardiac rehab to overcome whatever challenges there are to getting to cardiac rehab, so they may have transportation issues, to sticking with some of the exercise programs or some of the diet changes, and talking with them about, what are the challenges for them? Are there financial challenges? Are there motivational challenges? Do they need a buddy to exercise with? Do they need classes and more information in how to cook healthy? Do they need somebody to help them interpret language interpretation when they go to classes at cardiac rehab? So community health workers have a key role to play in supporting these other services that are available to people. Now you can identify procedures for diagnosing and treating heart attacks and describe community health worker activities to create care connections for people with a history of heart attack or at high risk for heart attack. Congratulations on completing Module 2. Don't forget to go to the Google Classroom to complete the assessment for Module 2, Heart Attacks. Your next module will be Module 3, Heart Failure.